All right. Good evening, everybody. Thank you so much for taking time out to log on to another session once again. My sincere apologies to everyone who is on the Pacific Standard Time. We in England completely got it on the other side. So obviously, we have a time change next week. So I think there was a little bit of a glitch in terms of timing. So anyone on the Pacific Standard Time who was expecting us to come on at 8 a.m. your time, my sincere apologies. Again, thank you to everybody for logging on and those who are going to catch up later on YouTube. Thank you, obviously, for listening again. Today's World Oral Health Day. I'm going to smile with a big smile because I'm proud of my teeth, even though I've got loads of gap teeth. But I'm still proud of it. I'm proud of my smile. And today we have an amazing dentist, Dr. Kim Benton, who I'm hoping I will pronounce the city correctly, who resides or her practice is in Daly City, somewhere around San Francisco. And she actually opened the Vista Pacific Dental Clinic in 1998. I'm not going to say how young I was at that time. And she caters for patients of all ages. So today we're actually going to be listening in on the dental, part of diabetes learning. Today, I'm actually going to learn. I was saying to Dr. Kim earlier that it's actually a learning ground for me as well, because I know when to refer patients, but I actually don't completely understand the link. So obviously having a dentist here is an area where a lot of people actually have an oversight and don't understand the relationship between diabetes and our oral health. So why not a better day to actually understand the link between diabetes and oral health day on World Oral Health Day. So we're not advertising any toothpaste. We're not advertising any company's products. We're actually talking about your oral health. So without further ado, I'm actually going to introduce you to Dr. Kim Benton. And I'll just get you to tell us a little bit about yourself. What inspired you to become a dentist?
Thank you, Tanya. Thank you for having me. And I'm so happy that we met and we decided to come together to talk about this very, very important topic. What decided me to become a dentist, I'll tell you quite honestly, it was a God thing. What I mean by that is my dad is a dentist, and ironically, I did not have great experiences in the dental chair. I ate a lot of junk as a kid, so I was in the dental chair quite often. But unfortunately, I felt very uncomfortable. And I think in hindsight, that's probably what inspired me to realize that a lot of people don't like coming to see us. I get it. But if I could help make that a more pleasurable experience and make you feel a little more at home, then we can talk more about your oral health and how that can improve and impact your total health. So ironically, yeah, that's kind of how I ended up in this field.
Amazing. Seriously, I wouldn't say I still am. I think I would just wonder who that sound, that buzzing sound just gets to me. And I would get palpitations just thinking about going to the dentist. But then like you, I ate quite a lot of sweets when I was younger and there was no proper oral health. So maybe I've had quite a lot of feelings, and I'm very strict on my child now. And I keep saying, don't want to go on that chain that way. So she really loves the dentist because she has a different experience. But anyway, I want to ask you, why is dental health or oral hygiene so important? Before we go into diabetes, just generally, why is dental or oral health important?
Sure. So it's important because if we don't remove the plaque in our mouths, plaque is that kind of cottage cheese material that's on our teeth when we brush. If we don't remove that, that's loaded with bacteria. And that bacteria does two things. It literally hugs the tooth, and it can actually penetrate the tooth to cause cavities. But that same bacteria can slide under the gums, literally eat away the bone where our teeth are housed and cause gum disease. And problems with gum disease or cavities, that's going to affect your ability to chew and eat well. And if you can't eat well, it affects your digestion, it affects your overall health. So it's just really, really important when I hear patients and a lot of times kids come in and say, oh, I don't have time to brush. I have to find ways to encourage them to help them realize brushing your teeth is just as important as washing the rest of your body. So it's an interesting journey.
Yeah, just diverting a little bit before again we go into diabetes. A lot of people, especially within certain continents or certain parts of the world, I guess people are changing, don't understand why they need to brush your teeth twice a day. You know, at least that's the minimum I know. I've been told twice a day. You need to brush it in the morning when you wake up to get your breath fresh, I'm guessing, and to take off the plaque. And you brush it at night to take off all the food particles and don't eat before obviously you go to bed. So that's why it's the last thing at night.
Yes.
Is it compulsory for people to actually brush their teeth twice a day, or can people, as they always argue with me, that once a day is sufficient for them?
Twice a day is really best. And I have a colleague of mine that explained it this way, like you just said, to brush the food off right at night. So think about an egg that's cooked over medium, right? It's a little bit runny. And think about that egg on a plate, right? The runny egg. Well, what happens if you come back 3 or 4 hours later? Is that egg still runny? No,
Yeah.
it's not. It's stuck on the plate, right? Do you want that kind of feeling in your mouth? So yeah, I know, right? When she told me that, I thought that's a really good example. And that's what happens. And the other reason why, one, to get the food off, but two, plaque forms every 8 to 12 hours. So by the time you get ready to go to bed, you've got more plaque. And you're just continually setting yourself up for that bacteria to just have a field day in your mouth. So once, of course, is better than zero, but twice is ideal.
Never thought about it that way. I think I'm going to use that on my little girl and just, well, she never argues. She brushes her teeth. But I think that's what I'm going to explain. You know, get a runny egg and leave it on the plate in the morning, come back in the evening, and then we'll use that as an example, which is a good one. So, in terms of diabetes, can you tell us how diabetes is linked to oral health?
Absolutely. So what happens with diabetes, whether you're type 1 or type 2, you have excess blood sugar, right? So that blood sugar travels throughout the whole body. And so when it comes to the mouth, if you think about sugar and think about things that you eat or drink, that's one reason why we encourage people to be careful with the sugary foods and things that cause that break down to acid. Why? Because it increases your risk for those things we just talked about, tooth decay and gum disease. But the studies show that when you're a diabetic, because your sugar is consistently feeding bacteria in our mouth, and the mouth gets more puffy and bleeding and all sorts of things like that. And also when you're diabetic, you tend to be a little bit more parched. So that leads to more dryness in your mouth. And when you have more dryness in your mouth, the bacteria loves it. And so it thrives. Saliva is what we call a natural lubricant. But when you're diabetic, you tend to have a drier mouth. You also can end up with something called thrush or candida. And candida is a fungal issue, right? Some of us think about it with babies. Babies, very early on, sometimes they get that white coating in their mouth and they call it thrush. Well, we as adults can get that as well. So it's those three things. When you're diabetic, it feeds the blood sugars, and also you have a drier mouth, and you increase your risk to having that thrush. So those are the main things. That's the main connection.
Okay, that's interesting. So, are there particular symptoms that we actually look out for if someone actually does have diabetes? Like if you're performing a dental procedure, for example, are there particular things that we can actually say to people? These are signs that you may, or point to the fact that you may have diabetes. Are there particular symptoms? I know the symptoms that I look out for in clinic, but are there particular symptoms? I know bleeding gums, but obviously you can expand on more than that because you're the dentist, so you know other symptoms.
Yes, the gums are bleeding because they're very puffy. Inflammation is the key. inflammation, right? And when we're inflamed, especially in the mouth, the gums are puffier than usual. They bleed very easily. Sometimes they're even swollen. And those are definitely some signs. So when you're in the dental chair with me, and let's say we're doing a cleaning, and generally your teeth should not bleed when we clean them, right? Every now and again they might, because maybe the person hasn't been to the dentist in a while. But when you're diabetic, they bleed very easily. I mean, you barely touch the gum tissue and it's just oozing with blood. So those are the key symptoms that we see in the dental office. And of course, when we see that, we start asking questions. Any family history of diabetes? More often than not, there is. And ask when's the last time they've been to their primary care and got checked. But that's what we see. The gums are very puffy, they're inflamed and bleed very, very easily. So those are some of the signs and symptoms that we can see when a patient comes in.
Okay. Are there any other, apart from bleeding gums, are there any other symptoms that people ought to look out for? I know you mentioned thrush, but
Yes.
would you really thrush to diabetes?
Possibly. So that's pretty rare, to be honest with you, that we see it. But if there's no other underlying issues that could be causing it, that could be it for sure. The thirstiness. So when you're diabetic, you're thirsty quite a bit. So as a patient starts to share that with us, and then the dryness in the mouth. So the inflamed, puffy, bleeding gums, the dryness, we can literally see it. Sometimes the cheek will stick, you know, you go in to try to maneuver, and literally it's kind of sticking to the teeth. So we see the dryness, we see the puffy gums, sometimes see as well. So when you symptoms, that's one question. And because we're not diagnosing diabetes, we're helping people become aware, and then in really engaging them and sharing with them the importance of following up with their primary care.
Okay. I've got someone raising hands. I think Lewis is. I'm not sure if he's trying to ask a question or giving you a thumbs up in terms of, but I have no clue. And I can see he's taking it down. So I think he was probably in error. Apologies. So obviously, how would you, so if someone had bleeding gums, would you encourage them to, where do they go from there if they've got bleeding gums, profusing bleeding gums? Is it something that's every day, or is it something that's once in a while? What would you tell them to do afterwards?
So I would definitely have the conversation first on their basic hygiene, because more than likely that same person with the bleeding gums is not flossing. And so flossing is so important. Flossing definitely removes the plaque. Well, everyone thinks you need to floss to get the food out of your teeth. That's true. But the main reason you want to floss is, I like to say, think of it as brushing between your teeth, right? Toothbrush can't reach between your teeth. And so I have that conversation to have them go over with me their home care. I'll even give them a piece of floss and ask them to show me how they're flossing. So definitely that's the first thing we do on our side, is making sure that their oral hygiene is where we want it to be, right? So as far as the next steps with the dental office is, that same patient, you know, traditionally we say you should see the dentist twice a year, which means about every 6 months. That same patient, I would probably bring back in 3 to 4 months, because we want to see the progress they're making up. We've gone over some tips with them on how to floss right, floss better, things like that. Speaking of which, it's better to floss with the string and not the little sword pick thingies.
Oh, can I ask why that is? Because
Yeah.
I'm guilty of using the sword pick things rather than the string.
Okay, well, see, it's good we're having this discussion. So the swords don't let you hug the sides of the teeth. If you look in your mouth, the gums kind of have a little scallop, right? The swords don't let you go on the sides very well. The string, I actually go over what I call the C-wrap technique, where we go in between the teeth, and then we create like a C around the tooth, wrap it, and slide the floss under the gum on both sides. You can't do that with the little picks. And so the pick in the middle of the day, maybe while you're at work or at school, but the string where you can actually slide it on both sides is what works best to remove the plaque.
Okay. And how often would you advise people to actually floss their teeth with or without diabetes?
Yes, minimal once, but twice is best. And if you're diabetic, twice for sure. Twice has to be your minimum because again, that plaque builds up faster in people that are diabetic. And if it builds up faster, it's going to cause more puffiness, more inflammation, more bleeding. So it's definitely at least twice a day if you're diabetic.
Okay. So if the gums are bleeding, now I'm just asking as a layman terms, and they go to the doctors, is that damage to the gums reversible or is it irreversible?
Good question. So it depends to answer your question. So bleeding gums, we call that gingivitis, which is the early phase of gum disease. But if that bacteria in the plaque hides under the gum and literally starts to eat away at the bone, and you have changes in the bone, you cannot reverse that. The puffiness, yes, but the bone changes, the bone loss cannot be reversed. So all the more reason why we want to get to the bottom of what's causing that.
Okay.
And so
That's
when
good.
you go to the dentist, what we in the States is we actually take, oh, go ahead.
No, go on, go
one
on.
thing we do here, yes, one thing we do here in the dental office is we take a little measuring instrument and we go around the gums and we call out these numbers. And that's on a scale from 0 to 12 in millimeters. I don't know how it's done in the UK, but it's checking the health of the gums. And so the goal is 3 or less. So if I'm doing those numbers and I get to the back teeth and now I have 5s and 6s, that tells me early signs of gum disease. Well, which one? Is it the gingivitis, which is reversible, or is it the bone loss kind? If it's the bone loss kind, we can't reverse it, but treating the gum disease at that level keeps it from getting worse.
Okay. It's quite interesting because I hear these numbers on the dentist. They keep going, molars, whatever number. And I'm thinking, why do they keep calling these numbers? And I've never ever asked because I'm just there thinking, just get over and done with it. Let me just go. I just don't like being here. But now I understand. So obviously, 3 or less is good, you're saying. So
Correct.
when I go to the dentist now, I would try not to panic when I hear 4 and above, if I do hear. Hopefully not.
Yes, hopefully not. And so 4s are easy to reverse because a lot of it just has to do with technique with flossing and frequency. 5s usually involves a more thorough type of cleaning. We call it a deep cleaning. And that usually involves getting you numb so that we can go under the gums to clean really well. That means that the plaque is hiding way under the gum. And the only way to get rid of that is to go under the gum to remove it. Well, that doesn't feel too good if you're not numb. So we normally do one side of the mouth, say top and bottom on one visit, and then you come back another week or 2 and we do the other side, top and bottom, to remove it. But then this is the most important part, and I kind of tease my patients. I say, you have homework. You got to make sure you keep it away by flossing, right? And that's the key. The key is really helping people understand the importance of doing that so they can make those changes. And that's part of a lifestyle change, right? It's just part of everything else that we're doing. We're watching what we're eating. We're trying to move more and being more proactive. So a lot of it is a lifestyle change.
Okay. So 2 questions I'm going to ask, three last questions. The first one is, so technically what we're saying is brushing alone is not sufficient.
Correct.
We need to floss twice a day at least, same as when we brush our teeth.
Correct.
Do we floss when we brush our teeth 4 times, or do we floss during the day and at night? Or is there a system in place for people to remember?
Yes. So people ask me all the time, what's best, to floss first and then brush? Quite honestly, whichever way you want to do it is fine. But you do want to do it at the same time when you're brushing. Now, some people floss more often than that because during the day, if you're getting food stuck between your teeth, you don't like the way that feels. So you're going to floss to get the food out, right? But a minimal, yes, you should floss when you're brushing. In the morning, I like to brush first just because I want my breath to be fresh before I floss. In the evening, I floss first because I feel like, let me get the food out and then brush. But there's no rhyme or reason as long as you get it done. And it only takes really about a minute once you get the hang of it.
Yeah.
It really doesn't take that long.
Okay. And would you encourage children to floss? How do you teach kids to floss? Because it's bad enough trying to get them to brush their teeth. How much more floss?
Yes. So one time I don't mind if children use the little floss picks because it's hard for them to wrap it around their fingers, but absolutely. Children usually have spaces between their teeth and they're supposed to, and that allows, you have space between the teeth so the permanent teeth can come in later. So usually it's easy for them, but for in the habit of floss with the spaces is good. Sometimes with the kids' toothpaste or things, that's how to do the traditional flossing. But absolutely, it's a good habit for kids to start flossing early.
Yeah, the reason I asked is because obviously we have children who have diabetes, and if we're about gum health, then obviously we need to start encouraging them from when they're young to obviously floss their teeth. Now, my second but last question is, in terms of hygienists, would you then, someone goes through all the process of brushing and flossing twice a day, would you still encourage them, as well as seeing the dentist, to see the hygienist?
Yes, so here you're either seeing, most of the time when you come for cleaning, you're seeing the hygienist. But at the same time, the dentist comes over after the hygienist is done to check the teeth, to check the gums, etc. So it goes hand in hand here in the States. So normally a hygienist is working in a dental office for the cleaning, then the dentist still comes over and checks everything. For those rare instances where the hygienist might be, say, at an event or something special, it's not in a dental office, then the hygienist will definitely make those recommendations to the patient to follow up with their primary dentist. Because again, we have to check everything. We have to check the teeth as well as the gums. So it's important to see both.
Okay, right, that's a good one. Now, the last question I was going to ask before I get your advice and we wrap up is, there are certain, this is the pharmacist in me now talking, there are certain medications, knowing that people living with diabetes often do not have diabetes alone. They normally have kidney problems, or they have hypertension, or they have something linked with it. People always ask me, why do you like diabetes so much? I call it the spider web, and it's obviously mind-boggling, and I enjoy it a lot. Not having it, I don't have it. I enjoy treating people with it. So there are certain medications that someone who's got high blood pressure within the Black community, we tend to go for certain medications like calcium channel blockers. To simplify for our listeners, they are drugs like methamphetamine, amlodipine, felodipine, or amlodipine, as I say, or some people call it pine. Amlodipine and amlodipine, whichever one. Now, those drugs tend to increase the risk of gingivitis, oral gingivitis, which is what you talked about. Right. How then do we then managing their blood pressure, knowing that they increase that risk, and then they have diabetes on top of that? Would you recommend that we move away from using those drugs, or not?
Very good question. Calcium channel blockers, one of the side effects is inflammation of the gums. And so if someone's on a calcium channel blocker as well as diabetic, it's kind of a dual issue. So yes, I would encourage, especially if I saw that patient and their gums are very puffy and bleeding, I would encourage them to talk to their primary care to see if maybe they could switch the medication to another blood pressure medication. Beta blocker, for instance, atenolol, metoprolol, or hydrochlorothiazide, but something other than a calcium channel blocker, like you mentioned, amlodipine, nifedipine, would be best to switch if they're diabetic. and see if that works, because ideally, and that might be trial and error, right? Especially if you're switching to a complete different blood pressure medication. But when you're diabetic and already have the side effects from the calcium channel blockers, that's just a double-edged sword. So yes, excellent question. Anyone who's on a calcium channel blocker that's also diabetic should talk to their primary care physician about switching to a different blood pressure medication.
Yeah, that's something I always look out for, especially that's the first line they use within the Black community in England, or in patients who are 55 and above. So once you're 55 and above, and or you're Black, Black African, whatever Black nation you are, that's the first line, that's the recommendation. However, if your blood, so we're not saying, and I just want to justify this because obviously we're live, that everyone on calcium channel blockers should stop. No, we're just saying obviously that if someone's got diabetes, uncontrolled diabetes is what I'd like to say, you can correct me, and on calcium channel blockers, then we obviously need to look into that. Am I correct?
Yes.
Yeah. Okay.
You are very correct on that. Right. We're not saying stop taking your medication. Not at all. You always need to consult with your primary doctor, right? That conversation, let them know you talk. I find here in the States, they tend to start off with the things like hydrochlorothiazide or lisinopril, because it's a water pill, to try to get it down. And then a lot of times beta blockers, but everyone's different, right? Maybe they don't do so well. But absolutely, when I see a patient on a calcium channel blocker, even if they're not diabetic and their gums are really inflamed, I will have that conversation with them about talking to their primary care to see if there's another medication that they could switch over to.
Yeah. Well, thank you so much, Kim. I'm just going to say, do you have any last advice for anyone? I know obviously we're trying to promote our health with or without diabetes, because that's one topic in an area that a lot of people run away from or completely ignore. Do you have any advice to the listeners or anyone who's going to come back on later on to catch the replay?
Sure. I just want to reiterate how important your oral health impacts your total health and well-being. Here in the United States, about 20 years ago, we finally had one of our Surgeon Generals bring that to light, that if your oral health is not to par, your total health can't be. It absolutely can't. So the thing we talked about with diabetes and gum disease, if you have gum disease, you increase your risk for heart disease, for stroke, for rheumatoid arthritis, and have all kinds of issues with birthing. And the newest one is Alzheimer's. There's a big connection with the bacteria in our mouth and Alzheimer's. So what am I saying? Start with the basics. Please, please, please start with the basics. You're brushing and flossing, and don't go fast. Take your time. Sometimes you actually have to look in the mouth, maybe take your finger and see if you can feel anything. Your teeth should be sparkling, and not from a cosmetic issue, but from a health perspective. So if nothing else, the biggest takeaway is you've got to make sure your oral health is on point. Make sure you go to your dentist twice a year minimum. And if you have any issues or concerns, don't wait. Please go ahead and call your dentist, get in to get seen and see what's going on, and share this message with one of your loved ones. Let them know how important it is to brush and floss. And I know we've all heard that, but now we know there's actually science that backs the importance of it. So those would be my biggest takeaways.
So much. It's been really enlightening to have you on board, and I'm actually glad that we crossed paths. I always say to people, once you meet me, you can't undo me. So I'm stuck to you for life. But no, I'm really grateful for the time. And obviously, just for encouraging us. And I'm sorry about the glitch and the time difference as well. My husband is not at home to sort out the internet. You can tell I'm alone.
No worries.
Thank you so much. Hopefully, we can bring you back either sometime later this year or maybe next year again, just to continue to reiterate until people actually get the message. But thank you so much, Dr. Kim Benton, for being on board with us on this World Oral Health Day. And I want to thank everyone who's taking time to log on to listen. We really, really appreciate your time. Okay, until next time, I'm going to say goodbye.
Thank you, Tanya. I appreciate it. Look forward to us covering. Okay.
No problem. Thank you so much. Bye, everyone. Bye.
Bye.
Bye.